Hi there, my name is Dr. Matt. It's very nice to meet you. Can you please verify your first and last name and your date of birth? Okay, and your date of birth? Perfect. Do you have any allergies that you would like me to list? Okay. Go ahead and tell me what's going on with you. Okay. And for how long has that been going on? Okay. Are you experiencing any vision problems? Any blurry vision? Double vision? Okay. Are you wearing contacts? Okay, it looks to me that you are experiencing some neurological deficits. That means that we're going to do a very detailed cranial nerve exam today. Okay, so in order for us to do that, we're going to need a little bit more information about your medical history. Alright, can you please tell me, when was your last medical exam? Okay. Have you ever been diagnosed with hypertension? Are you taking any medications on a daily basis? Okay. And have you noticed anything abnormal with your smell? And for how long has that been going on? Okay, 3 months is definitely a very long time. Any changes with your taste? And how is that affecting your eating habits, your weight? Okay. Have you experienced any weight loss? Okay. Have you noticed any changes with your hearing? Okay, is that in both ears or just one? Okay, we're going to do some audiology tests to make sure that your hearing is intact. And sensory-wise, are you experiencing any pins or needles? Okay, any shooting pain down the spine? And is that in the back of your neck? Here? Okay. For how long have you been having that pain? Okay. Okay, perfect. Let's go ahead and take your vital signs first. Okay, I'm going to take your blood pressure. Do you have an arm preference? This one is okay. Alright, I'm going to ask you to pull your sleeve up for me while I get this ready. Okay, perfect. So I'm just going to go ahead and wrap this around your arm. Good. Just relax, and if you can, please uncross your legs. Okay. Okay. Alright, blood pressure is a little bit low. Are you feeling dizzy at all? Okay, so let's go ahead and take the cuff down. Very good. And any flu-like symptoms? Okay, I always ask this since we're doing a sublingual. Have you been drinking anything cold or warm? It's just that it might affect the rating, that's all. So you did drink a little bit of ice water? Okay. Alright, we're gonna put this under your tongue. Very good. Okay, let's go ahead and check that. 98.3. It's not too low, so that's good. I'm going to take your oxygenation. This is going to go on your index finger. Go ahead and insert that here. Good. And I'll ask you to take a deep breath in and breathe out. Very good. Okay, heart rate is definitely a little bit elevated, 107. And oxygenation is 95% on room air, so that's not concerning at all. I'm just going to go ahead and take your vital signs and insert them in your electronic medical records here. Okay. Looks like we were logged out. Such a shame. So we're just gonna have to log back in. Okay, perfect. So our blood pressure was 108 over 55. So your diastolic was a little bit low, but not too concerning. Heart rate was 103. Have you been drinking any coffee today? And how many coffees? Okay, that might explain. Sometimes drinking too much coffee can definitely trigger tachycardia, which is an elevated heart rate. I'm going to listen to your heart first, so let's go ahead and just put your shirt a little bit up for me. Perfect. So we're gonna go ahead and breathe normal for this, okay? Good. Okay. I can hear only S1 and S2, no S3, no S4. Just going to go ahead and switch. We're going to listen with the bell now. We're looking for any murmurs. Okay, for this, I'm going to ask you to take a deep breath in and hold it for 1, 2, 3, and breathe out. Very good. So let's go ahead and check your lungs now. Take a deep breath in for me. And exhale. And again, take a deep breath in. And exhale. Good. One more time. Take a deep breath in. And exhale. And again, take a deep breath in. And exhale. Very good. Okay. You can go ahead and put your shirt back down. Okay. So we're going to check your pupil dilation. I'm going to ask you to look straight at my nose. I'm going to flash a light in your eyes. Very good. Keep on looking right here. Okay. I'm just going to define your field of vision now. Okay. Good. Okay, very good. So I'm just going to bring this a little bit closer. Alright. Good. Okay, very good. Let's go ahead and check your peripheral vision. Go ahead and tell me when you see the pink globe. No. Okay. What about now? No. And now? Okay. And now? No. Very good. I'm going to cover one eye for you. Go ahead and tell me when you don't see the light in your field of vision. No. No. Good. And again. No. 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 Okay. Go ahead and follow the light with your eyes only. Don't move your head. Okay, go ahead and look right here for me. And again, look here. Okay, I'm just going to go ahead and lower your eyelid. And same thing here. Okay. Alright, so what I'm going to do now is I will move my fingers right here in your field of vision. I'm going to need you to tell me which fingers you see, right fingers or left. So just say right and left. Good. 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 Okay. Good. 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 Perfect. Okay. Can you tell me when you don't see my fingers in your field of vision? Right. Good. Okay. Good. Okay. Okay. So just go ahead and look at the light and tell me when you don't see it anymore. Okay. Keep on looking at the light. Okay, you're doing great. Okay. Perfect. Just follow the light. Tell me when you don't see it. Okay. Good. Okay. Very good. Go ahead and look at my fingers. Good. Okay. Go ahead and look at my fingers here. Okay. Follow my finger with your eyes only. Don't move your head. Good. Go ahead and tell me when you see the light in your field of vision. Now, good. Now, good. Now I'm gonna have you follow the bee with your eyes only. Don't move your head. And don't let yourself distracted by the light, okay? Good. Very good. Okay, I'm just going to bring the bee a little bit closer. So keep your looking at the bee without looking at the light, okay? Alright, that was good. Let's go ahead and we're now going to look at the star here. Good. Keep on looking at the star without looking at the light. Okay, just follow the star now. Okay, so I'm gonna have you focus now on the star here. Okay? So keep on focusing on the star for me. Okay, now look at the butterfly here. Just look at the butterfly. Okay, go ahead and look at the blue star without letting yourself distracted. Okay. A little bit of shift of focus there. Let's go ahead and look here at the daisy. Look at the daisy. Okay. Alright, I'm gonna ask you to cover one eye and can you please tell me how many fingers you see? Okay, good. What about now? Same. What about now? Good. And one more time. Good. So I'm gonna do the same thing on the other side. How many fingers do you see up? Good. 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 Alright. Go ahead and tell me when you see my fingers in your field of vision. Good. 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 Okay, perfect. Let's go ahead and check your ears now. Very good. Go ahead and turn your head a little bit. That's perfect. Alright, tympanic membrane is pro-gray. I'm not seeing any redness. Good. So we'll just have to keep on going and see what else we find. Alright, go ahead and turn your head the other way. Very good. Excellent. Alright, I'm just going to gently pull here on your ear. Any pain when I do that? Good. Tympanic membrane is normal. I'm not seeing any signs of redness or inflammation. Good. Perfect. Okay, I have here a tuning fork. I'm just going to put it behind your ear, so we're checking for any fluid buildup in the eardrums. Go ahead and tell me when you don't hear the sound anymore, okay? No. What about now? Tell me when it stops. No. Okay. Now I'm going to put it in two positions. Position number 1, position number 2. I'm going to need you to tell me which position here is louder, 1 or 2, okay? Okay, so this is position number 1. And this is 2. Position 1. Okay. And this is position number 1. And 2. Definitely 2. Okay, so it seems like your left ear is having a little bit of fluid buildup. Let's go ahead and check with a different frequency. So go ahead and tell me which position here is louder. I'm just gonna do that one more time. Okay. Position 1 or 2. Okay, what about now? Position 1 or 2. Okay. So I'm just going to palpate here behind your ear. So we're checking mastoid bone to see if there is any kind of inflammation. And we're checking on both sides. Any pain here? Okay, what about here? And here. Okay. So we're gonna go ahead and check your sensations now. I'm going to ask you to close your eyes. Go ahead and close your eyes. And tell me on which side of your face you feel this, okay? Good. What about now? Good. And now? Good. And now? Good. 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 All right. Good. Good. All right. Okay, go ahead and keep your eyes closed for me. Good. And tell me on which side of your face you feel this. Good. 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 Okay. Okay. Now we're going to touch it with two objects. One is going to feel sharp and the other one is going to be a little bit dull. Go ahead and keep your eyes closed for me. Perfect. Tell me if you feel this dull or sharp. Okay, what about now? Good, and now? Good, and now. Okay, and here? Good. And now? Sharp, 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 dull, 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 dull. Okay. Let's go ahead and check your olfactory nerve now. So I have here a few samples. One is called Stress Away, and you're going to love the smell. So go ahead and close one nostril. Okay, very good. And go ahead and breathe in and breathe out through your mouth. Good. And if you need to, go ahead and do that one more time. Breathe in and breathe out through your mouth. And this does smell like chamomile. Okay. This one is definitely a flower. So go ahead and close your other ear now. Good. And breathe in. And exhale through your mouth. Good. And again, breathe in. And exhale through your mouth. Good. What does that smell like? Lavender. Very good. I think I do have one more. This one is called Deep Relief. So now I'm going to ask you to keep your both ears open. So go ahead and breathe in and breathe out. And again, breathe in and breathe out. You might feel a few tones here, not just one, so anything that you have, I'll just accept. Mint. Okay. Anything else? Lemonish. Alright, very good. Let's go ahead and check your taste now. But before we do that, I'm just going to go ahead and check your mouth. Alright. So go ahead and look straight at me right here. Very good. Keep your tongue out for me and say ah. Good. Thank you. Good. Just one more time. Say ah. Good. Yeah. A little bit of redness in the back of the throat. Okay, go ahead and push your tongue out for me. Good. And move it up and down, side to side. Alright, go ahead and push inside your cheek like that. Any difficulty doing that? And the other side. Okay, very good. And I'm gonna ask you to shrug your shoulders for me. Just strong. Alright, I'm gonna try to push them down. Don't let me do that. Good. And I'll put your arms in front of you like this. Good. I'm gonna try to push them down. Don't let me do that. Alright. Now I'm gonna try to move your head to the right. So let's go ahead and resist. Good. And to the left, resist. Alright. Okay. I'm going to go ahead and check your taste now. So what I'm gonna do is I will spray a little bit of this solution. Good. And I will scrub your tongue just for a second. So I'm going to ask you to push your tongue out for me. Good. Alright. One more time. Perfect. So that was definitely a good amount. How did that feel? And how would you describe the taste? Okay, so it was sweet. Very good. All right. There are a few more tests that we could do, but I think that for now we are good. So I'm just going to go ahead and prescribe here, just so you can come back in a few days. Would that be okay with you? All right. Okay, so we're gonna continue these and have a few more tests done. Probably we're going to send you to a CT scan. Alright, so go ahead and take some Tylenol or ibuprofen is needed for your pain. And also, I recommend a little bit of stretching the neck muscles. Yeah, that usually helps a lot. It was very nice to meet you. I'm going to go ahead and walk you outside. Yeah. Alright, so go ahead and follow me.